Hey everybody, welcome back to Sing 2020's YouTube channel. Thank you so much for coming back. Today we have one of our good friends and a wonderful physician who's going around the country, Angelina Farella. And I'm going to bring her onto the feed and give her a chance to introduce herself. Angie, tell us a little bit about yourself, your credentials, what you've been doing, your career history. Let our audience know who you are and why you've gotten so involved in this.
Absolutely. Thanks for having me. I'm a pediatrician. I've been a pediatrician for 25 years, and I got involved really with this whole COVID issue because I couldn't understand why doctors all of a sudden kind of forgot their medical training. So what had happened was for us in our area, and we're southeast of Houston, things were just starting to close down during the pandemic, and we were getting calls because I determined I was not closing for my patients. We started getting calls from adults that basically said, our doctor's closed, we're sick, we're not feeling well, our doctor won't see a sick patient, we're not getting any treatment, or even worse, they went to the emergency room and were told to go back home and wait until they got sicker. So this was kind of a very routine call we were getting over and over and over again, and I just did not understand that logic. So of course I stepped up to the plate and just started treating people for respiratory disease because I'm a pediatrician. I treat respiratory disease all the time. I figured at the very least, I was going to try something. I was just going to try something. I'm very familiar with asthma protocols and how to treat asthma, which, bronchiolitis, bronchitis, pneumonias. I know how to treat that. So that was a no-brainer for me. We started supplying people with nebulizers and giving them nebulizer treatments, antibiotics, and also steroids, both inhaled and oral steroids. And we were seeing some progress. I also found a protocol from a friend of mine on what they were using with great success. And that's with the hydroxychloroquine and using azithromycin as another option. So we were using multi-drug therapy and doing really well. We were seeing patients, word of mouth spread that we were treating, and that's pretty much history at that point. We did not see many kids. I'm a pediatrician. So the weird thing was that kids weren't coming in. It wasn't affecting kids, which is a great thing. That was not a bad thing. I was very thankful for that. I had looked in the literature and saw that even in China with the outbreak, they also didn't see many kids that were affected. And the only children that were affected tended to be very mild. And also it was contracted usually from their mom. So it was within the family structure. They were not passing it from the children to the other children or the children to the parent. It generally was being spread from the parent to the child. So I was seeing that same exact pattern here in Texas as well. And so that was actually a good thing for me. But at the same time, I was kind of frustrated with some of my colleagues who just closed their doors and refused to treat COVID. You call around and people were telling me, well, I called my doctor and they said they don't treat it. There's no treatment.
So what was the standard of care for those other facilities? Can you give us an example of and this will, I assume, for much of our audience is going to sound familiar, but what were these other doctors doing? We got an idea what you were doing. What were they doing?
From what I was hearing over and over again is they would either call their doctor first. Their doctor would usually turn them down and tell them, oh, give us a call back if you get worse, or go to the emergency room. So many people went to the emergency room or urgent care where they were tested, and their tests usually were positive, in these case scenarios. And when I asked them, well, what did they give you? They said nothing. They told me to take over-the-counter fever control medication like Tylenol or Motrin, and they told us to take vitamins. If we were lucky, they were told to take vitamin D, vitamin C, and zinc. Although early on, they were told really not to do anything, just to sit at home until you got worse and return if you got worse, which to me, again, just did not make any sense at all.
So, if our audience wants to go into more detail on a lot of this stuff, they can go check out the movie, seeing2020movie.com, which you're in. And we're so grateful that you were involved in that. And now we've had these opportunities to kind of tour around and talk to people in theaters, at screenings. And you're touring around with AFLDS and Dr. Gold. Tell us a little bit about your guys' tour. What's been the main focus? What are you hearing from the audience? Give us an idea how it's going out there.
Yeah, the tour is awesome. I mean, I got to join them in Tennessee and in Houston. So the venues were very different. The one in Houston was a very cozy venue, and we really did get a chance to interact with the audience quite a bit. And people were asking questions about what our opinions were. In Tennessee, it was a little different. In Tennessee, we did 2 days worth of talking to people. The first day, we had multiple panel discussions about cancel culture, not just with doctors, but also about medical freedom and how corporations now are mandating something that's not even mandatable, if that's a real word. But because of this quote unquote niece, which really isn't a niece, it's really a biological agent, is still under emergency use authorization. By law, it can't be mandated, yet there are corporations that are mandating it and really coercing people and making them feel less of a human being because if they refuse this experimental jab. So there were pilots that were talking about this. There were pharmacists that actually got let go from large chain pharmacies because they questioned whether or not they should be giving the jab to children. And so it was really eye-opening. I had not seen that, so that was pretty fascinating. We also had discussions the next night, which was more of an open forum, and there's a lot of concern out there. I was speaking with a woman who was pregnant, and she was extremely concerned about being around people that have already received the jab. She was very concerned about, how it may affect her pregnancy if they forced her to get the jab. So there's a lot of concern out there. There's a ton of concern out there. And I just feel that we are really making a difference by getting more personal with people. I mean, it's one thing for us to be online and talk to people online, but it's a whole different situation when you're actually in an in-person venue. And the vibe was awesome. And people were very receptive. But really, they're just seeking information that they can't get elsewhere. And that's what's really sad about this entire situation.
Okay, so you're touring around and you're getting a lot of these questions. I would imagine that most of the questions have shifted from treatment because now I think it's out there. I think people are realizing more and more and more, and even the major hospital chains and large organizations are starting to go, okay, treatment is good, right? When we made the movie, everything was saying no treatment, no outpatient treatment, no recommendations. I mean, it was crazy town because you guys had been doing it for months. But it seems like the attention's going towards the jab, right? And of course, YouTube, Facebook, all these guys basically said anything that promotes vaccination hesitancy is problematic. But that I don't think that should deter the conversation because I think it's important that we just simply share pros and cons, things that a parent should talk to their pediatrician about. And if the pediatrician doesn't have answers for these questions, then, consider searching for another opinion because there's a big push to jab kids. And you're talking under 15. We're talking about a enormous minority of who actually gets severely sick and dies. I mean, the cost benefit analysis seems almost obvious, to saying, why do these kids need this? They're barely getting sick at all. So as a pediatrician, someone who's read research on this jab, has understood, the VAERS data, looked at that. What would you tell, or what should parents talk to their pediatricians about before considering getting their kids this shot?
There's quite a few things that they should really consider. The first thing is, this is a disease. COVID-19 is a disease that doesn't really affect children. You know, they have a 99.997% survivability if they contract COVID, and it's usually a very mild disease. There are the few rare kids that get the MIS-C disease, truly, truly very, very rare. The jab, on the other hand, is a little concerning because these families are told, the first thing that they're told is that this is an FDA approved vaccine, and it is not. It's not FDA approved, it is under emergency use authorization. And they often need to ask, like, well, you know, what does that exactly mean, emergency use? You know, and it's really for high risk populations. That's what emergency use means. And unfortunately, it has been distorted. And parents are thinking that it means like everyone is in this major emergency, so everyone needs to protect each other and get the jab. Let me be very, very clear. As a pediatrician, I have given over, you know, I have vaccinated over 10,000 children easily in my career. And so I never have seen a vaccine being promoted as much as this one is. I mean, every time you turn around, there's a huge promotion for this everywhere. I have never seen a vaccine that has not even been studied in children, given to children. Was never studied. The initial studies never studied it. The other studies that they did do in kids was very, very small cohorts, very small numbers of kids, and they were very short. There is no long-term safety data at all. And in pediatrics, that's a huge, huge thing. So parents need to ask, you know, well, where's the safety data? Because I don't think a lot of people understand what VAERS is. A lot of doctors don't. You know, if you're not in pediatrics, you probably don't really even know what the VAERS data bank is. And VAERS data bank is a CDC data bank, and it stands for Vaccine Adverse Event Recording System. Okay, so when you have an adverse event to a vaccine, you're supposed to record this. By law, doctors are supposed to report this into the VAERS database. Some of the doctors, for sure, are being, especially those that are employed by large universities, are pretty much being told that you just need to do it. It's like your job depends on promoting this vaccine. And they don't really ask about informed consent. Informed consent also is very lacking, super lacking, because a lot of these jabs are being done in civic centers, gymnasiums, you know, drive-throughs at a pharmacy, or drive-through at a you know, any little building.
At a baseball stadium.
Oh my goodness, yeah, in Houston they were doing it at the baseball stadium. Today I saw a sign that they were doing it at the NRG, which is a big convention center. I mean, we've never done this before, ever. You know, I'm not a proponent of getting these vaccines at a pharmacy, even because of safety issues. Not because you know, anyone can be taught how to give a vaccine. That's not the problem. The problem is that if someone has an unfortunate event and it happens in front of them, those people are not trained to take care of the patient. That's my big concern. You know, if you get your shots in a doctor's office, well, guess what? You have trained personnel that can respond. They don't respond the same way in a CVS or a Walgreens or a Rite Aid or any other pharmacy for that matter. That's not what a pharmacist is trained for. So they also need to ask, you know, what about the difference between, what if you have a problem with the first shot? What if you have had COVID and recovered? I think it's really important that these questions get asked before you get the discussion. And I'm going to tell you why. So in pediatrics, if you get chickenpox, you do not get a varicella. You're done. You're naturally immune. It's finished. You never have to get it again. It's not a big deal. However, in COVID, they seem to forget this point. And COVID recovered people do have natural immunity. And up to 50% of our kids already have natural immunity. So that is potentially a big problem, because we also know from studies that if you are a COVID recovered patient and you go and get one of these vaccines, you have a 2 to 3 times greater chance of a very severe adverse event happening to you. So we are now potentially endangering up to 50% of children that are going forth with this, with no one even paying attention to natural immunity. And that's bizarre, because we all know that in medicine that natural immunity is better than any immunity.
And if you can you share that any of the articles that reference that research you just mentioned, so I can add it to the description of this video? That'd be great.
Yeah, I can all the references here.
Sweet, awesome. I think Court may have had a question.
No, I didn't think Adam was going to let me talk, but he is finally. Thanks so much for coming on. I'm just grateful to have you back, and thank you for doing the movie. And I agree 100% with what you're saying. And I think it's interesting, the perspective on COVID recovered patients, that, you know, even in adults, or actually any informed consent period, let alone covered recovered, there's none of that's going on. You know, people are just, here, come, get in line, sign this paper, wait here for 5 minutes. You know, that's the essentially herd mentality, which is what they're going for. I get that, but they're treating you like a herd, and they're pulling you through this, you know, process that has no concern about your safety or your health or your history or anything about that. So that's huge for me on both adults and kids. So thank you for just saying what I've been thinking too, for from this perspective of actually think about your health. You know, that's what I would tell individuals is, you know, your kids' health matters, and long-term health matters, not just, you know, this year and this week and this but what's going to happen long-term. Do you want them to be the guinea pig in a study? If so, that's fine. You know, it's your kid and you can decide for them, but I don't think people are thinking about that. So I thank you for that. And thank you for going out and, you know, going in with AFLDS and sharing with people some actual educated answers that they can get from somewhere besides the mainstream media that won't share it. So the question I have for you is about going forward. What do you see as the future of vaccination for kids? Do you think it's going to be mandated in schools? Do you think it will get FDA approval and then be forced on more and more, or what do you anticipate?
Well, you know, unfortunately, lots of colleges are now mandating it. This makes me very nervous, because we know that one of the very severe adverse events is something called myocarditis, which is a swelling basically of the heart muscle. We have already lost I think it's up to 380 kids under the age of 17 to myocarditis. These kids, we have more children being hospitalized for myocarditis than we actually had hospitalized for COVID. That's a problem. It's a big problem. Myocarditis is not something that's mild, which in the media I hear, you know, oh, a side effect is a mild myocarditis. It's not mild. It has repercussions for decades to come. These children need to be on medication for 3 to 6 months and cannot have any sports participation for those 3 to 6 months until they are completely cleared. And I can tell you, on the pediatric front, I'm highly disappointed in what's going on there, because I talked to some docs that may not be like-minded, and that's okay. I mean, I just want to know their point of view and what they think. So I reached out to one who said, in his mind, the myocarditis wasn't as bad as the MASC disease, which he has seen. So when I asked him, well, what's your numbers? Of course, I haven't heard back from him yet. But my concern is that these healthy kids never had a problem before, now all of a sudden are having problems. There are reports of kids dying within 24 hours from heart attacks. That's not normal. That is absolutely not normal. We have kids, there's a report of a young lady. She was 19 years old. She was in college, and she got her second immunization. And then within 2 weeks, myocarditis set in to the point where she had a heart transplant and still passed away. I mean, and it happened very quickly. We're talking within 6 weeks. She got the myocarditis, got so bad that she required a transplant, got the transplant, and it was not successful. And this is not normal. These are healthy individuals prior. So someone needs to kind of raise a flag somewhere that this is not normal. This is not what these guys ever do. Now, my other concern is, because I am a pediatrician and I do vaccinate, that's part of what I do, is that this is going to just ruin these us vaccinating kids in the future. I mean, I think
The perceptions, yeah.
Yeah, like they're going to be so scared. It's going to ruin it completely. I have absolutely no doubt whatsoever. I see it in my office already. People are like, I'm not anti-vax, but can we wait a little while now? What about this? They're cherry picking which they want. I try to guide them as best as I can. But it's going to be a really hard sell to anyone, really. I mean, especially, in my case, I've studied these vaccines, these mRNA vaccines, and I don't like the fact that it's new technology, and I don't like the fact that we have no long-term studies on it. Safety is paramount in children. Most of our vaccines do not even touch a child until there's been 3 to 5 years, sometimes even 8 years of safety data. And this has 6 months? It doesn't look good. It doesn't look good at all. We're seeing, the VAERS data for deaths is in excess of 5,000. And for kids, now we're seeing this myocarditis in very large numbers. This is not a rare event. This is something that's happening immediately, and it's happening in large numbers in children under 17. Because if you think about it, really, they've only started doing for kids under 17 in the last maybe 4 to 6 weeks. In some areas, it depends on where you are. But the risk factors are, the younger the adolescent, the higher the risk for myocarditis. That's extremely scary when we're talking about going down to 12 or even younger, 5, 6, even talk about 6 months and above. Why do these kids need this? It doesn't make any sense. They are not in danger of becoming super sick or dying from this. They're actually the exception.
Well, and just community spread right now is essentially zero already, if you look at numbers. So I just question, why we would need to, continue to force it. And you mentioned too that it's never been promoted or coerced, or I see it on billboards every day driving to work. I'm like, seriously? Like, when is this going to stop? And that's in a conservative state, right? So I can only imagine what it's like in different states that have got to be just, not only bribing people, but pushing it so hard that and I think you're right. The unintended consequences is going to be vast and huge with vaccinations in the future. So the ones that are actually useful are not going to be given.
No, people are too scared now. They don't know what to think. They don't know who to trust. We have patients that come into our office and they're like, well, our other pediatrician was just gung-ho, just do it. And when we questioned, they got mad and kicked us out. I mean, this is what's going on, and I just find that amazing that all of a sudden now doctors are becoming discriminatory against patients who don't want to take an experimental that's never happened before. I mean, it's happened with FDA vaccines, I know that, but not like this. This is so different. There's no conversation, is what my new patients are telling me, is that if they bring it up and that doctors is just gung-ho and wants it, and they balk a little bit, then they are asked to not return to that practice. That to me is just incredible. I just can't even get over that.
Wow, that's insane. And then, sorry, just to use that term, but it is. And then the last thing I think that we really wanted to touch on was schools and the use of schools for inscription sites. And you mentioned it a little bit that just one big concern is safety and who's there to do it. But then I think the secondary thing we want to talk about is just the whole idea behind that. That it's I guess again, informed consent. Comes back to that. Parental consent, I guess, for this. Is this happening, and are parents allowed to consent, or are teens allowed to consent themselves, or what's happening with that?
So it varies state to state. So in some states, the law states that children as young as 11 can give informed consent. I wholeheartedly disagree with that. In Texas, although they cannot give consent at 12, I just saw an email from our particular ISD that stated they put the they call them informed consent forms on the email, and it says on there that it has to be signed by a parent, but it does not say that the child has to be accompanied by a parent when they go to the Private Center, which happens to be a gymnasium at the school. In our district, we have 3 different locations, and they're rotating them. So it was 3 different schools last week, 3 new schools this week. I have a big problem with this. I went to the school board and I told them I was really opposed to them using the school. Number 1, it's our taxpayer dollars. Number 2, God forbid anything happened and no one's there to treat the emergency. And thirdly, we've never done this before, ever, ever. So, when I asked the school board point blank, when have you ever done flu shot clinics, for instance? Never. They never have given immunizations at our schools before COVID. So it just kind of rings a little bit of a bell for me that there's a flag flying somewhere. Are they using this as a fundraiser perhaps because they probably get paid per shot, per individual? I'm going to go with yes, that is an issue. Absolutely. The health departments do get to solicit the school districts and ask them if they can use the facility. At our particular school district, only the superintendent has to say yay or nay. So the school board wasn't even asked their opinion. They didn't vote on this. I know that for a fact because I was at the school board meeting prior to these vaccination clinics going up. The only vaccine that they're offering is the COVID vaccine. There's no other vaccines being offered. So this whole thing is just kind of fishy. I'm not saying that, we shouldn't do vaccines at a school per se, because there are schools that actually have physicians in the school. They have these like teen health clinics and things of that nature. That's a different story. This is not that kind of thing. This is a entity coming in, like the health department coming in to the gymnasium of the high school, setting up shop, and that the ISD is the one who is marketing it and promoting it for the health department. But again,
rounding up the cattle.
Yeah.
Yeah, it really is like, it's this rounding up cattle.
Mm-hmm.
It's crazy, crazy, crazy. So what do you think? Do you think it's going to continue to, what's going to stop it or change it?
Parents are going to stop it. They're the only ones that can stop it, honestly. I mean, if you don't show up with your kid, they're not going to waste their time and money. And if parents start screaming about the fact that they have a gymnasium with the AC on, we're in Texas, so it's like 1,000 degrees, right? So a gymnasium that has the utilities on, the lights on, taking away from taxpayer money and taking away from the education of our children, they may stop and listen. So parents really need to rise up. This is something that, I'm a doctor, I'm a parent. I've went to the school board really because my children go to that school that they're doing this clinic at. I don't agree with it as a physician. And I don't think that the school board should not vote on this. I mean, they should vote on it because they are in charge of our tax dollars. And so more parents need to kind of stand up and say, this isn't right. We have doctors and they're breaking the patient-physician relationship, which is even more dangerous. So when you start to look at that whole aspect of another entity coming between the patient and the physician, whether it's a school, whether it's the health department, whether it's a pharmacy, any of those things, that is a very dangerous situation because the patient is not getting the proper information from their trusted healthcare professional. We are the ones, especially in pediatrics. I mean, we doctors have to give informed consent all the time. Every single time I have a patient in my office, I always ask if they had any problems with any of their vaccines in the past. It's one of my very first questions. And if they tell me, yes, we discuss it, and there's a determination whether or not that child should receive vaccines. This is not that at all. It's literally sign this form, get in this line, get the jab, and walk out the door. No one is providing any consent whatsoever. And if they are allowing kids just to show up there with a signed form, that's criminal, especially in our state. That's criminal. Children are not supposed to get any kind of care without a parent being present. It's very scary.
So it sounds like that we need to mobilize, all of our moms out there and try to get them to at least stand up to the districts and let them know that, one, if I've said this before in other circumstances, but if you're being taxed for a service, you better get that service. And if they're going to qualify that service with something like, well, you need to get this jab because otherwise we're not going to give you the service, then that's ridiculous. If that means you can't use the service you're being taxed for unless you get a jab, then go ahead, stop taxing me for that service. I won't use it. I'll use that money somewhere else.
Absolutely. Absolutely. And I think, a lot of these local governments, so to speak, are just going rogue with this. The independent school districts have been having problems with this for years. Parents are standing up because they're not in favor of the curriculum that's being taught. They don't appreciate the fact that kids are being bullied. And, this is a bully situation. I tell this to people all the time. I'm like, 2 years ago, there was such a, report the bully. And yet this past year, these past, 18 months or so have been nothing but adults bullying kids about the masks. Now it's adults bullying children about the fact that they may bring some virus home and kill grandma. That is ridiculous. That's the dumbest thing I've ever heard. And it is really psychologically damaging. And these kids they don't get this virus. They get it in a cold form. They don't get it like adults get it. They are not the spreaders. They're the buffers. They have a 99.997%, essentially 100% recovery rate. And now we are exposing them to something that we don't know may have repercussions for future, for decades and decades. I mean, these kids have decades and decades to live. We have no idea what we're injecting them with. We have no idea the long-term effect of this injection. It's very, very scary, especially when we're talking about that it's a genetic biological agent. It's a totally different thing that we've ever dealt with before, ever.
So I just pulled it up.
I was going to just real quick, that concentrates in the ovaries too. That's a big thing that we just discussed with Dr. McCullough today. And that scares me for little girls, to think of that we don't know what their reproductive outcomes are going to be other than they're going to be bad. There's already animal studies showing that it's decreasing fertility. And then in addition to that, there's human studies showing highly likely, collection of this and the damage to your DNA in your ovaries. So, I mean, that's just frightening to me. Sorry if YouTube's going to block us there for that, Adam, but it's true.
Yeah,
so
they might.
Too. This is not, there are doctors that are seeing very unusual, crazy things with menstrual periods and spontaneous abortions. Unfortunately, these mommies are miscarrying and after getting the jab. I mean, again, why are we giving this to pregnant women? It doesn't make any sense. We are, essentially under the age of 50, if you're a healthy adult, you have a greater than 99% chance of surviving this. So it just doesn't make any sense that we're playing roulette with this. It makes me crazy. I mean, these are women who wouldn't eat a piece of sushi.
Yeah, I was going to say. And what really irritates me is, the American College of OBGYN is recommending it with no data. And I guarantee you, the second that this comes to, well, I'm sure the American Academy of Pediatrics is actually already recommending it to the adolescents with no data. I mean, it just goes to show that physicians have lost control of not only data and science, but, their own organizations are out of control and ran by essentially media and politics, I think. I don't know.
Yeah, I think one of the things that we mentioned at one of our events was that young physicians, especially ones working for large corporations, they're not practicing medicine anymore. They're enforcing protocol, right? They don't have to. It's easy not to think when you just look at the piece of paper of protocol and let a lawyer, most likely, or a board member tell you how to practice medicine, because at that point it's not medicine, right? Everything I've learned from filming doctors for 10 years is that medicine tends to be, when done properly, a mixture between creative thinking and scientific data, right? You take the data and you think creatively based on the biology of the person in front of you. But now, I've talked to 2 or 3 friends who are young doctors, and the ones that are very much like, well, towing the line, they're just like, well, I was told by my superiors at the hospital that doesn't work. Like, well, were you told that, or do you know that? Like, what data did they give you? Well, they just gave a memo.
No, they don't investigate anything anymore. I mean, that's the crazy thing. I mean, we were taught discernment when we went to med school. We were taught how to read scientific journals and scientific articles and how to tear them apart and how to figure out, is this a good study? Is this a bad study? That does not happen anymore. It just doesn't happen anymore. I mean, I can tell you horror stories about that, but these people that are going through med school right now, the younger generation of doctors that are just about to graduate or just graduated, they don't learn any of this discernment. Everything is on an EMR. There's, red boxes that flash if something gets inputted in your data entry clerk. I mean, it's ridiculous. It's checking boxes. And it's because we've monetized medicine. It's because now we practice medicine based on what someone's insurance is going to pay. And it's ridiculous. That is not medicine. That's actually a really bad idea. But, we allowed the insurance companies to come between the physician and the patient. And again, this is just a slow melding of forces that now is really driving the wedge between a physician and their patient.
So unfortunately, it's been a great conversation. I'm going to wrap things up with just this little bit of data based on the CDC website. As of right now, I'm reading it right now. All sexes, all ages, there's been reported 590,091 deaths to involving COVID. Those of them that are 0 to 17 years old is 322. So it kind of gives you an idea of where the deaths lie and where the risk is, and then give parents the chance to have, right? We've talked mostly about informed consent. Do the parents know, are they informed properly so that they can make a proper decision for their own family and their own kids? Are they getting the information that they need? You just mentioned that just this issue with swelling around the heart. Remind me what it's.
Myocarditis.
And we've reached over 300, you said?
Yeah. Oh, easily. That's what's reported. So that, and we know that that's very, very low. We also know that there are some institutions that are discouraging reporting of numbers.
Adam, you're muted. But I just want to say thank you for coming and sharing and taking your time. I encourage you parents out there to do your research, to look at VAERS, look at the data, and then consider what's not being reported, and consider the risk to your child and your family, and just be smart about your decision making, because it's frightening. And for your own sake and safety, be sure you're informed before you make your child that guinea pig in these studies that are ongoing, essentially.
Cool. Thank you guys so much. We're just going to wrap it up. Don't forget to like and subscribe. We're trying to bring out as much content as possible so that you guys can make proper decisions for yourself and use your freedom of choice here in a free country to make these decisions on your own. Thank you, Dr. Farella, for everything that you're doing, and we hope that you can keep doing what you're doing because it's fantastic. Thank you so much for joining us.
Thank you.